Enjoy this conversation with me, Maureen Kimani, every Friday from 9 a.m. on our Health Corner show here at Capuchin TV. Your health is your wealth.
A very good morning to you, dear viewer. Thank you for joining us on this live show, coming to you live from Capuchin Studios as we bring you this conversation of a Health Corner show right here with me, Maureen Kimani, a program brought to you by Capuchin TV in collaboration with St. Mary's Mission Hospital, where we delve in conversation concerning your health matters, lifestyle, mental health, and many more. And of course, today we're very delighted to bring you this conversation, as you can see down below on your screen, that is sickle cell disease. And we would love to understand what is it all about, because I understand there is a lot of misinformation and stigma surrounding this disease. And joining me in the studio, we have a guest from St. Mary's Mission Hospital. She will be introducing herself in just a few. And if you'd love to be part of this conversation, you can share your insights and comment on 0717 424 866, or you can use our SMS number, that is 21760. Welcome to the discussion. Hello.
Hi, Maureen.
I'm very good. How are you doing?
I'm fine, thank you.
It's good to have you here. Thank you for making time.
Thank you for having me.
And because it's the very first time we are having you here, please say hello to our viewer, introduce and tell them who you are and what you do at St. Mary's Mission Hospital.
Okay. My name is Esther Opuba. I'm a medical doctor who has specialized in pediatrics and child health. I'm also a very keen advocate on holistic growth and well-being of our children. My passion is empowering mothers and also the family at large on their chronic illnesses so that they are able to take charge of their health. And recently, I've also been participating in a lot of research activities, especially in pediatrics. And my approach to research is to look at research as one of the strategies to improving childhood mortality and morbidity. I'm based at St. Mary's Hospital, which is in Langata. It's a level 4 hospital that is a faith-based hospital. And we do a lot of work with children, and I'm happy to be here to discuss sickle cell disease today.
Wow, that's a very nice introduction, Dr. Esther. Thank you for making time. And just to mention before we start talking about the conversation, it's that approximately 5% of the world's population carries trait genes of hemoglobin disorders, mainly sickle cell disease. And that's why we are having this conversation by creating awareness, because I mentioned that there's a lot of stigma surrounding this and a lot of misinformation. So please shed more light to our viewers and provide a basic, overview. What is sickle cell disease?
Thank you, Maureen, for that question, and also for highlighting how important and how we are not discussing about this disease enough. So sickle cell disease, to put it simply, is a disorder of the blood. The blood, as we know it, is that red fluid that is found inside the blood vessels. When you cut yourself, whatever flows out, that is blood. It is a tissue that has many cells within it. There are red blood cells, there are white blood cells, and there are platelets. Blood, the main function of blood is to carry oxygen to all the organs in the body. And also it carries nutrients to all the organs in the body so that the person is able to thrive. So it plays a very important function. The red blood cells are what are affected in sickle cell disease. So the red blood cells, their work is to carry oxygen, and they have a substance within it called hemoglobin. So hemoglobin that is normal in a normal human being, there are two strands. There is hemoglobin A and there is hemoglobin A2. So those are the normal variants of hemoglobin that are found. But in sickle cell disease, there is an error in the gene that is responsible for creating hemoglobin in the red blood cells. So this error occurs during birth and during conception. During that early development, something goes wrong with the gene responsible for manufacturing of hemoglobin. So instead of the hemoglobin A, hemoglobin S is formed. And this hemoglobin does not function in a normal way. The red blood cells are usually round, they are very soft, they are able to be deformed in a very proper way so that they are able to move swiftly in the red blood cell channels, which are called the blood vessels. So in sickle cell disease, the hemoglobin S is very rigid and it forms the red cells to look like a sickle. If you remember, in agriculture, there was an instrument there called a sickle, which was used in the fields, and it looks like a letter S or C. So when you look into the microscope, when you're looking at the red blood of someone who's affected with sickle cell disease, you will see the red blood cell looking C-like. And that is where the term sickle cell disease comes from, because historically, when people were looking at these children and people affected by sickle cell disease, when you look at the blood under the microscope, you would see sickles. And the problem with hemoglobin S is it cannot tolerate low oxygen circumstances. Whenever there is reduced oxygen level in the blood, the red blood cells sickle. And when they sickle, they form a plug within the blood vessels. When they form a plug within the blood vessels, there is no good flow of blood to the tissues. When the tissues don't get enough blood supply, they don't get enough oxygen, and it results to those organs being damaged. It results to low oxygenation to those particular cells. It results to low nutrient supply to those cells, and now it starts manifesting as signs and symptoms, which we will discuss broadly.
Wow,
Yes.
thank you very much, Dr. Esther, for that information and introduction of what is sickle cell disease. And just to mention, sometimes people prefer or maybe refer calling it or describing it as a crescent. Because you talked about the sickle in agriculture, and now we have the crescent one for the moon. Please tell us, what are some of the types of sickle cell disease?
So that's a very technical question, but I will simplify it. There are many types of sickle cell disease. So as I have explained, that the basis, you have two strands of hemoglobin, A and A2 mostly. But when there is an error, that error can either affect both strands of hemoglobin to lead the person to have hemoglobin S. Both strands of hemoglobin get hemoglobin S, so that will be sickle cell disease in its essence. But sometimes there are people or patients or clients who get another form of sickle cell or another hemoglobin type called beta thalassemia. So you will hear doctors talking about beta thalassemia, sickle cell disease, or broadly we will just call them as sickle cell thalassemias. There are others who will get hemoglobin delta, so those ones will be called sickle cell with delta thalassemias. So there are very many types, but the ones of interest to the community, sometimes we have a group of people who get the hemoglobin A, but they also have a percentage of hemoglobin S. But you would find that the hemoglobin A is in greater quantities of more than 50%. So these patients, we classify them as having sickle cell trait. And the unique thing about these clients is, number one, they will not manifest with the disease. And most of the time, they actually don't know that they have the sickle cell trait. And most of the time, one realizes whenever they now conceive a baby who has sickle cell disease. So part of the process, when we find a child has sickle cell disease, we offer genetic testing to the mother and the father, because we know definitely that this baby inherited that disease from the family. That is where majority of the parents realize that they were carrying the sickle cell trait. And the trait, it is important to know so that you can plan your family, because the way sickle cell disease is inherited, both parents have to have the gene for sickle cell disease, and when both parents have sickle cell trait, there is a 25% chance that they will get an offspring who is affected by sickle cell disease. There is a 50% chance that they will get offsprings who are affected by the sickle cell trait. So you find that this disease is transmitted in families, and it is important when you have a family history of sickle cell to come for that genetic testing so that you're able to choose your partner and also plan your pregnancies and see what are your options in terms of getting your family.
All right, thank you very much. And you talked about such that one would have a sickle cell disease and maybe not know until you have a baby. That's when you discover you are a sickler. Would you say that this is a silent killer disease?
For most, for the ones who have the sickle cell trait, they're the ones we call the carriers. So these ones, they live a totally normal life and they do not have any signs of the disease. Even when we find out that they are carriers, there is no medication we give them. We just give them genetic counseling and also screen the partner for that carrier state so that they are able to know the risks of getting an offspring. But now, sickle cell in the community is really underdiagnosed, especially in communities that the disease is not very prevalent. The geographical distribution of sickle cell in Kenya, you'd find that the most affected population is in the Nyanza region, the western region, and also in the coastal region. That is where we have a lot of sickle cell disease. We cannot explain that geographical distribution. We don't know what exactly has made it that we would almost always diagnose patients coming from those regions, or whenever there is an intermarriage to that region. And also in Africa at large, most of the sickle cell is found in Western Africa. So for those patients who are carriers, they live their normal life. But in these regions, it is good to have a very high index of suspicion whenever you have signs and symptoms that are pointing towards anemia, signs and symptoms of a child not growing, getting recurrent infections, so that these children are screened. So I would agree with you and say it is a silent killer because it is underdiagnosed, and once it is not diagnosed, definitely that increases the risks of mortality for those children and even for the adults who are living with sickle cell.
All right, thank you very much. And actually, I wanted to ask you about where our country stands when it comes to sickle cell disease, but you have been able to answer that. It's like you read my mind.
Yeah.
So please take us through on the signs and symptoms of the sickle cell disease, and maybe you can give an experience of what you have interacted with the patients there at St. Mary's Mission Hospital.
Thank you. So the signs and symptoms are very broad, and I want to put it in a way that anyone listening to me can be able to also look at those symptoms and see probably there is a child around you having certain things that you think are really pointing to sickle cell. So when you have that hemoglobin that is not normal, one of the things that you will get is that the body will look at this hemoglobin as something foreign that needs to be cleared from the body. And there is an organ called the spleen that is found inside the abdomen, just next to the stomach. So the spleen acts like a recycle bin. It just clears everything that is not wanted by the body, and especially anything that is inside the blood. So the spleen will be very hyperactive in trying to clear out these red blood cells that are sickle-like, and this will lead to anemia. Anemia is low blood level in the body, and the symptoms of anemia are usually the commonest things that will bring a child or even an adult to us, and this will be one of the red flags that will make you as a doctor or as a clinician to look for sickle cell disease. So anemia will lead, it depends with the age of the patient we are talking about. If it is in the newborn period, you will see that the baby is not that active. The baby is not able to breastfeed well. the baby is not growing well. When you go to the clinic, the weight is not adding as what you would expect the weight to add. By the time they are reaching 6 months and you're introducing complementary feeds, this child has very poor appetite, is not able to feed. When they are supposed to be walking at around 1 year, these children usually have delayed developmental milestones. They are not catching up compared to the rest of the population. They're not very active. They would want to always be sleeping and sitting in the house instead of playing with the other children. So basically they are very tired children, and they are also very small. They are not growing appropriately as per age. When you move further along into the older children, these are children who will actually complain of now fatigue. They are always tired, they are always sleepy, and even the older ones will tell you now they feel dizzy. The adults will complain about symptoms of anemia like dizziness, and also feeling a very fast heart rate because of that anemia. There are other symptoms that are now related to the blood being cleared at a very fast rate. When the blood is cleared at a fast rate, there is a pigment called bilirubin that is usually secreted from that red blood cell. Bilirubin looks yellow, so it starts staining the tissues, and where you will see it first is in the eyes. The eyes of most people are usually whitish, but now for these children or patients who are affected by sickle cell disease, it will really strike you that the sclera, that white part of the eye, looks completely yellow. And it can be so severe that you can even see it in the gums of the young children. Some of them can even get that yellow pigmentation in their tongue, and even in the hands you can be able to pick that pigment. Okay. Sickle cell in itself can also affect virtually all the parts of the body. When I start from the head in the central nervous system, you can get symptoms of stroke when the sickle cell is very severe. Because of that sickling event, it leads to blockage of the vessels that are supplying the brain. So the way you see someone presenting with a stroke, sudden inability to walk, sudden inability to talk, a person who was able to do a lot of movements by themselves suddenly is not able to control their function, that can be one of the signs of sickle cell, especially when it is combined with hemolysis that gives you the jaundice in the eyes and also gives you the anemia. One of the common things that most patients will come to us that will suspect that this is sickle cell is something called a painful crisis. Sicklers are one of the patients that really live with pain, which is not a very good quality of life. So these children will present with a lot of crying in the newborn. You're not understanding why the child is crying. Mm-hmm. If you're careful to look at the child and undress the child, you might find some swellings, especially of the hands and the feet, that you do not understand where those swellings are. A lot of mothers have come to me, and many times we have made the diagnosis from a child just coming with a swelling on the knee. And the mother says, I'm not sure if this child fell down or something hurt her or something is happening that I'm not understanding. Mm-hmm. So you probably treat it on that one day. The child goes back home, comes again with another swelling, either on the same part or a different part that is not related to trauma. So these swellings are usually in the joints, and they can also affect the small, the hands and the feet, and they are recurrent. They go on their own and reappear. This one is one of the very classic signs of sickle cell disease, especially in a newborn, and I would advise anyone who has seen any such child to present for further diagnosis and further evaluation. They also get a lot of pain in the abdomen because the spleen is very active and it's swelling and it's trying to clear the sickle cells from the body, so it's overwhelmed and they would really complain about abdominal pain. And these are the children that go to the hospital. Sometimes they're told, you have amoeba, you have typhoid, you need to stop eating githeri, or you need to stop eating beans. But in real sense, they just need an expert to look at them and look at their blood and see. The other thing that they will also present is a lot of pain in the leg. So the pain issue is a big thing. Any non-specific pain in a small child with the other symptoms of anemia that I have described are a risk factor, or they are a trigger to tell you that you need to evaluate this child for sickle cell. One other very important aspect is that these children, they get recurrent infections. The mothers are always in hospital treating a pneumonia, treating diarrhea, treating meningitis. So this will trigger a doctor to see what is the blood level of this patient. Where do they come from? Do they come from the areas that are endemic or have very high prevalence for sickle cell? Then you would screen these children. And it is because of that recurrent clearing of the red blood cells, it makes their immunity so low. And this makes us also boost them with a lot of other vaccines that are not part of the commonly scheduled vaccines to just try and boost their immunity. Then even the heart is affected by sickle cell disease. They can get what we call a myocardial infarction. This is basically the heart lacking oxygen and lacking blood. So they would present as if they are getting an MI or a heart attack in common words. So these are some of the signs and symptoms of sickle cell disease that is important for mothers to be able to pick up in their children. And I'm talking especially to those who are living in endemic areas and could be having children who look like this. It is good to present to the hospital so that now we are able to make the diagnosis.
All right, thank you very much. And sometimes you find when you take a child to a hospital and then you feel they're not healing, you transfer the child to another hospital. What are some of the risk factors that can be associated with that? Because if you take your child to another hospital, there's a different medication this child is given. By the time you're coming to realize this child is a sickler, maybe they are at the age of 22.
Yeah.
What happens in that scenario?
It's unfortunate, Maureen, but that's why we have different levels of hospital. And when you look at different levels of hospital, it's about who is in that hospital. If, for instance, you take your child to a dispensary, there's usually a nurse there. They're able to do a lot of primary preventive medicine. But if you present yourself to a dispensary and on your first instance, your issue is not able to be handled, my advice and what I usually try to empower mothers is try to move a level higher than where you are. Because sometimes you find that it is also about the knowledge of the healthcare worker and also ability to make that diagnosis and the infrastructure and the lab abilities that are in that place that would not enable people to really make that diagnosis. So sometimes most of the people in the community are hampered by financial constraints, but the best way to handle anything that you're not able to sort out at the lower levels is always to refer. And sometimes patients are referred, sometimes they are not. But my message is, even you as the caregiver or as the mother, take initiative. And if you feel you're at level 3 and the problem is not being sorted, try and move to the level 4, try and move to level 5, try and ask for the experts. If it is a child you're dealing with, try and get a consultation with a pediatrician, because right now I think we've done a lot of work in training specialists and trying to just distribute these specialists at all county levels. So you'd always find there is a consultant from level 5, from level 4, level 5 and level 6. So move your child to a higher level to get that expert opinion.
Okay. And we talked about the stigma surrounding this disease and a lot of misinformation. how does one live with a sickle cell disease, and what should a patient need to know about this disease?
Okay, that's a very good question, and it's part of actually what I do almost on a weekly basis, because we see a lot of sickle cell disease patients at St. Mary's. We run a clinic on Thursdays to address that. And our locality actually is in the Kibera area, and when you look at the population around there, most of them are from Western and from Luo, Nyanza. So we have a lot of clients, and when these clients come in, the purpose of that clinic is to tell them how to live with sickle cell disease, because sickle cell disease is a lifelong disease. It is something that one needs to embrace and just get as much information as you can about how severe is the disease, what are your signs and symptoms, and what should you be able to do whenever you have emergency signs, what should you be able to do when you have urgent signs, and how should you follow up your clinic. So my message is mostly to mothers, because I know a lot of the biggest population that is living with sickle cell disease are children. And you know, children are not independent, and they really depend on their caregivers to be able to get the help that they need to be able to take their medication. So the first thing is for the parent to accept the diagnosis of their child. If you do not cross that step as a parent and as a doctor, you will not be able to help that child. Because I've seen a lot of patients going back home and trying to get alternative medication, trying to get help from now the church and places of worship, which is a very good thing to supplement the medication, but you cannot fully depend on the spiritual aspect without being on the medication. So the first thing that you should know is that the patient is going to be on medication throughout the entire life. The other thing that the patient should know to be able to live with the sickle cell disease is there are three main medications that we usually give to be able to cope with the signs and the symptoms. The first one is to try and reduce the level of hemoglobin S, because hemoglobin S is a problematic hemoglobin that will really lead to a lot of signs and symptoms of the disease and will make the organs to really damage. So we give something called hydroxyurea, and hydroxyurea stimulates formation of another hemoglobin called hemoglobin F. This hemoglobin is better than hemoglobin S because it tolerates low oxygen situations. So the longer you take your medication, and if the patient takes their medication very properly, you find that they are not symptomatic anymore. They have sickle cell disease, but they're not coming to hospital all the time, coming in with anemia, with the yellowness of the eyes, with recurrent infections. Then for all children who are less than 15 years, we give them prophylactic antibiotics. These patients usually have very low immunity, and their spleen, because of being overwhelmed, it usually just undergoes a natural death. And one of the functions of the spleen is to protect you from infections. So you find that when the spleen is affected, there is really recurrent infections. So we always put these children on prophylactic antibiotics. Every single day that they wake up, they have to take antibiotics called penicillin. Then we also give them a multivitamin called folic acid. Folic acid ensures that their blood level remains at a good level. It is not it's not compared to those who are not affected by the disease, but a good level that will not give you anemia, that will not give you the symptoms of anemia. So these are the three key drugs that every sickle cell patient needs to be on. Every mother needs to know that their child needs to be on these drugs and do whatever they can and come even to the government hospital. There are some that are giving them at very affordable rates so that your child is able to live a normal and quality life as much as they have the disease.
Okay.
We also supplement them with vaccines, vaccines that are not just part of the Kenya expanded program of immunization, but we give them extra vaccine like the vaccines for pneumonia, vaccines for meningitis, vaccines for preventing other types of sepsis that are very common with sickle cell. And then one also needs to know that there are some situations that will precipitate a crisis within them. We call a crisis because they will really come with severe pain. So children are very active. They like going for sports. They would go for mountain climbing. So we advise them, whenever you're doing these strenuous activities, there are things that you need to do. First of all, you need to make sure that your hemoglobin level is normal. Come to your doctor so that we are able to check that it is not too low for you to do these physical activities like mountain climbing. When they are going about their day-to-day life, they need to rehydrate very properly. So depending on their weight, we give them targets for how much water do they need to take so that they do not get the crisis. Yes.
Wow, what a very informative session that we had on our first session. That is Dr. Esther from St. Mary's Mission Hospital. And with that, we're going to take a very short break. But when we come back, we shall continue addressing more questions that are associated with sickle cell disease. So stay tuned for that, including what are some of the activities that St. Mary's have set just to create awareness for the patients who have sickle cell disease. And so stay tuned for that. We shall be right back after this.
Enjoy this conversation with me, Maureen Kimani, every Friday from 9 a.m. on our Health Corner show here at Capuchin TV. Your health is your wealth. Feeling unwell? Seeking expert medical care that prioritizes both your health and well-being? Welcome to St. Mary's Mission Hospital, Langata, where compassionate care meets cutting-edge medicine. At St. Mary's, we believe in providing holistic health care. Our dedicated team of healthcare professionals is committed to delivering personalized care to each and every patient. Nestled in the heart of Langata, our hospital offers a peaceful and healing environment for patients to recover and thrive.
We have masses every day, weekdays at 6:30 a.m. in the morning and also in the evening at 6:30 p.m.
Your health is our top priority. Experience the difference with compassionate care you can trust. Whether you're in need of routine medical care, specialized treatment, or emergency services, St. Mary's Mission Hospital, Langata is here for you. We offer a comprehensive range of services including outpatient, inpatient services, laboratory services, comprehensive care clinic, MCH and maternity.
We have labor and delivery. We also have postnatal care, and also we deal with mothers who've come that are sick and are there in the antenatal period. That is antenatal care. Generally, we admit every mother who walks in labor and any mother who comes from the clinic for monitoring of labor and also delivery services. And also in maternity, we have a theatre whereby all mothers who are not delivering normal are usually taken to theatre for cesarean section.
Ophthalmology, pharmacy services, radiology and sonography, dental services, pediatrics, physiotherapy, ICU and HDU services, dialysis.
Here we do dialysis for kidney failed patients, and we do it from Monday through Saturday. We welcome you all. We accept all insurances and cash.
specialist clinics and CT scan services. Experience your health difference with us. Visit us at Langata or our branches in Nairobi at Cardinal OTUNGA PLAZA and in Rift Valley, Elementaita, Nakuru County. For more information, contact us at 0797 972 794 or 0769 781 880 or 0717 305 204 or email us at info@stmarysmissionhospital.co.ke. St. Mary's Mission Hospital, Langata. Compassionate in healthcare. Enjoy this conversation with me, Maureen Kimani, every Friday from 9 a.m. on our Health Corner show here at Capuchin TV.
Hello, dear viewer. Welcome back to our conversation right here on our Health Corner show at Capuchin TV with me, Maureen Kimani, a program brought to you by Capuchin TV in collaboration with St. Mary's Mission Hospital. And we're glad to bring you this conversation about sickle cell disease. In case you are joining us, welcome. And for those ones who were tuned into our first part, welcome back. And so let's continue diving into this conversation as we shed more light about sickle cell disease and how can the loved one support or the caregiver support the patients at home who have sickle cell disease. And of course, we would love to know, does St. Mary's Mission Hospital have an activity for the patient who have a sickle cell disease, or maybe to create awareness? Stay tuned for that and welcome back. Welcome back, Dr. Esther.
Thank you.
Yeah, let's continue with our conversation because we talked about the medication at our first part. Could you kindly shed more light about the diagnosis of sickle cell diseases to this patient?
So once the patient presents with some of the signs and symptoms that I've highlighted, symptoms of anemia and jaundice and possibly other complications, the first thing we do is we screen them. So there is a screening test called a sickling test, and this can be done at even the lowest level, even at level 2, level 3 hospitals. And when you look at the blood under the microscope, you'll be able to see sickle cells. You most likely is having sickle cell disease, but it does not confirm. There is a confirmatory test that looks at the hemoglobin quantity in the blood. It's called a hemoglobin electrophoresis. It's a more technical test that can be offered, and you'll find it from level 4 hospital, level 5 at St. Mary's. We do it, and this is the one that confirms that you have sickle cell disease. So once we confirm that diagnosis of sickle cell, what we want to classify it is how severe is the disease. What is the quantity of hemoglobin S? If it is very high, if both strands are affected, then that's a severe disease. Then there are usually other forms of disease that will help us know about the progress of that disease and how to put those children on drugs and which drugs we'll put them on and what is the dose of that drug.
Okay. And what about when it comes to the importance of follow-up clinic? Because I understand this disease is a lifelong disease, and the importance of making sure that you take the medication for the patients.
So the clinic is important in 3 main ways. The first one is to ensure that there is good quality of life for any patient that is living with sickle cell disease. So we manage the symptoms and we also prevent complications. And in case complications happen, we are able to pick up the complications and manage it so that this patient is able to live a full life that is not just a life but is also quality, free from pain, free from infections. The other important thing of coming to this clinic is you'll be able to get other multidisciplinary care, like having the nutritionist on board, having a genetic counselor, a counselor who will not only help you to know about your disease but also counsels the other family members, because we all know the burden of taking care of a patient with a chronic illness, especially a child who does not understand. So there's a lot of emotional burden to the mother, and we are usually aware about that. And the whole point of this clinic is to journey with this mother, to journey with this patient, to journey with this family, so that they are able to manage the sickle cell disease.
All right. Talking about the loved ones and the family, I know the family plays a very big role when it comes to supporting the loved ones who have either a certain disease, whether diabetes, everything. What is the role of the family, or how can the loved ones or the caregiver support, especially the children who have sickle cell disease?
Family is very important, and in fact sometimes when you get children who don't have a very good family social support, it becomes so hard for us to be able to journey with these children, because the family not only form that social network for this child to be able to thrive, they are also the first line to be able to escalate any issues that they are seeing with these children. For instance, if it is a child living with sickle cell disease and they are at risk of this painful crisis, it's a family that will identify that this child is not okay, and they would be able to escalate to us. And the other thing also, the role of the family is to ensure that these children come to the clinic. The financial support from the parents, from the other rest of the family members is very important. And when we began, we highlighted that this disease carries a lot of stigma. And a lot of stigma actually comes, surprisingly, from the family, because you'll find some families alienate those who already have sickle cell disease, whether it is extended or immediate, or you label them as certain sort of things because they are always sick, so you feel like maybe they play the sick role too much. So having a family that understands the disease is very important, so that that family, that patient feels supported and surrounded and loved by the correct people. When we move from childhood to adolescent and adulthood, in fact, that's where most of the deaths occur. Because now when the children are growing up with sickle cell, they're really protected by the mother. They don't even understand what disease they have. They just know that they come to the clinic every month. But now when we are transitioning them from adolescent to adulthood, we empower them and tell them, listen, this is what you have. You will have to now take ownership of this disease. So if you do not have a very strong and a very core family there, that's where we lose these children, because they go into denial, they get into depression, they just want to fit with the rest of the teens, and they're not fitting because of the way they look. The girls are seeing their eyes are looking yellow and wondering how are they going to interact on the social front. They're always sick and in pain. They're not able to fit. So if you don't have a strong family to accept and embrace these children and support them in the transition, then we lose the fight. And that's how the family is really a very important aspect of sickle cell disease.
Okay, and I remember in our first part we talked about the stigma surrounding the sickle cell disease, and I think this comes because of the myths and misconception surrounding the sickle cell disease. Could you shed more light about that? Because I understand some believe it's a curse.
Yeah. In fact, one of the things that makes the patient come to us very late is because one of the things that they believe is that there is a curse there, that that family is cursed, and it can all be explained genetically. You probably just have two parents that are both carriers who have come together naturally without knowing, and now that they're having offsprings with sickle cell. And then because of our cultural practices in certain areas, you find that there is a very close intermarriage within that set community. So we propagate the genes. And this propagates the notion in the community that, you see, that family is cursed because all their children are always getting this. So that family just secludes itself from the community, and it becomes a very big problem. They don't even bring their kids. I've interacted with families where a child was born, has never been taken outside because of how that child is presenting. Another myth out there in the community is that sickle cell is equals to leukemia. A lot of patients are confused about that. They think, is it blood cancer? So will it kill me? These are two very different diseases. Leukemia is cancer of the blood cell. Sickle cell is just the hemoglobin being affected, and it can be managed. There are patients with leukemia who get cured. They get chemotherapy, bone marrow transplant, and they get cured. Sickle cell disease, you'll have to live with it, though we are going to talk about the new therapies that are prospective and at least a ray of hope to the sicklers. Another myth that I've also heard is that some of these drugs, they lead to cancer. So I've seen patients stopping the drugs and going for alternative medication, like alternative medications and like herbal medications, going for spiritual healing and leaving their drugs because they believe they have taken the drugs too long, so it's going to give them problems. The opposite is actually true. If you stop your drugs, that is when the disease will continue progressing. So journey with your doctor, ask the questions, the things that are worrying you, and there is a dose, and you usually escalate depending on how the patient is responding.
Okay. And we have a question here, and I think this question takes us to our last question, that is, what is the prognosis of sickle cell disease? And Emmanuel from Makadara says, can a sickle cell patient live to full life expectancy, and which gender is more affected?
So historically, it was always known. It was almost like a death sentence, and it was observed that patients who would get sickle cell disease would not even get to their adulthood mostly. By the time they were reaching their 18th birthday, it was almost like a miracle. But it's because there were no drugs to help manage their disease. There was no comprehensive follow-up. But I think with now a lot of research going into sickle cell disease and doctors understanding how this disease progresses and anticipating the complications, we are seeing these children living into adulthood. Recently, we are delivering mothers who are having sickle cell themselves. In fact, it was almost impossible, or everyone would discourage a mother with sickle cell disease to get pregnant because of the risks. The risks are still there, but at least we know the risks, and you're able to manage and journey with your patient. And now we are seeing that everyone is living to a very full life, a quality of life, and you're getting into the adulthood. So I would say the prognosis is good, and it is all about the quality of life, so long as you take part in that comprehensive follow-up and you journey and prevent the illnesses, prevent the complications, manage the complications that are there. Yes.
All right. And which gender is affected more?
There is no particular gender that is affected more, because all the genders can be affected. It is not a sex-dependent genetic transmission. So there are certain diseases that affect the Y chromosome, others affect the X chromosome. The Y chromosome is that chromosome that usually leads to the male gender. So if it affected any of that, then we would see it more commonly in boys. But currently, both genders are affected equally. It's just a matter of chance.
Okay, thank you very much, Emmanuel, for that question. And I hope you have been able to get the correct answer from Dr. Esther. Let's talk about the new therapies anticipated with people, living with sickle cell disease.
So currently there is a lot of research ongoing about stem cell transplant, and it's already happening for certain other diseases like leukemia. and it's leading to cure of leukemia. So basically the bone marrow is where all the blood cells are formed from. And so if the red blood cells are formed in the bone marrow, the scientists are thinking, can we not target the bone marrow and just kill the bone marrow cells that are producing sickle cell? And once you kill it definitely with chemotherapy, others are radiotherapy, so you completely wipe out the cells in the marrow that are forming those sickle cells that are not good.
Okay.
And then you get a donor who has normal red blood cells and who has normal marrow cells. You take a sample there, those are called stem cells, and then you transplant into the bone marrow of the patient that is affected by sickle cell. So that now the stem cells will start generating other red blood cells that are normal. And it is being done in the developed worlds, in the European and in the Americas, though you know that they don't have a very high prevalence of sickle cell like us. There are patients who are flying out there and doing it. The current practice has not really picked for it to be a routine thing, but there are those patients who have very severe disease, very high risk of getting complications that might be a risk in terms of death. So if you're getting recurrent strokes, recurrent heart attacks, that is very risky in itself. So there are specialists out there who are called hematologists and hemato-oncologists. So these ones, you can find a pediatric hemato-oncologist. This one is a pediatrician who has gone and specialized in blood and cancer. So they're the ones really pioneering and spearheading these new therapies. And it's really out there, and I'm encouraging people, make inquiries about them. Don't limit yourself to just what we have in Kenya, because everything is possible. There are other new things in the market that are also on trial, like the gene therapy. So this is about modifying the gene of the patient. And it is better even before conception, because you can be able to contribute the cells that are going to be now fertilized in vitro. So you can be able to modify that particular gene that causes an error. So that these are things that are still in trial in the labs. They have not reached the patient, but there is a lot of talk about using vaccines to lead to that gene therapy. So you carry that particular gene that you want to modify, put it in a vaccine, vaccinate someone, and then it goes and modifies their genes so that they're able to get now the correct hemoglobin. Okay. So these are trials in the market, and we are excited, even as budding researchers, to just support that and see a long-term solution for patients afflicted with sickle cell disease.
Okay, and when we were on our shorter break, we were talking about intermarriages, and I would love you to talk about the importance of genetic testing when it comes to these, especially before marriage. Yeah, could you kindly expound on that?
Yeah, so genetic counseling and testing is the only primary way of preventing sickle cell disease. So we know that there are geographical areas that the populations are more affected. In Kenya, it is the western and the Nyanza area, and also the coastal areas, certain parts of coastal areas. So these are the areas with very high prevalence of sickle cell. So in this area, we are really sensitizing the population, especially if you have a history of sickle cell disease in your family. There is a very high chance that you're a carrier. So that means you're living your normal life, but when we do the genetic testing, we might find that you're a carrier. The problem comes in when you meet another carrier. And most likely, if you're intermarrying within the same population that you come from within that locality, there's a very high probability of meeting another carrier. So when two carriers come together, there is a 25% risk of getting an offspring with sickle cell disease. If you get a carrier and a patient affected by sickle cell disease, there is a 50% chance that you're going to get a baby with sickle cell disease. If two sicklers come together, there is 100% chance that your child will have sickle cell. So that's why it's important. It is not to prevent love and marriage, but it is to know your risks. There are other options that you can have. You can make a decision where the doctor has weighed the risks for you. So there are people that decide, yeah, we know we are carriers, but we are going to take the risks and see, because your risk probably is low, or you will accept whatever outcome. So there are all these options on the table. So get genetic counseling and testing and make an informed decision so that we reduce the propagation of these genes in our communities.
All right. I know our time is up, but this has been a very interesting conversation, and I'm sure our viewers have been able to learn a lot. Please tell us about the upcoming activity at St. Mary's Mission Hospital, and how can the patients who have sickle cell disease and maybe they have their kids can come to St. Mary's Mission Hospital and get these services.
So we at St. Mary's, we've noted that there is a very high burden of sickle cell disease in our clinics. I think it is because of our surrounding population. And part of our community outreach activity, when we were looking this month and seeing what can we do to extend our hands into the community, we thought we should have a sickle cell camp that we have scheduled for next week, Friday. That is going to be 24th of May, that is this month. And we want it to be a sensitization camp. It's about empowering those patients who already have sickle cell disease about how they should take care of themselves, how they should manage their symptoms, how they should have multidisciplinary care. So we are going to have free consultations. We are going to have a nutritionist on board talking about nutrition in sickle cell. We're going to have vaccines that are usually part of the normal program for KP, and we are going to vaccinate children who are under 5 with these additional vaccines. And we are also going to be piloting our own sickle cell clinic. It is usually an integrated clinic currently that runs on Tuesdays and Thursdays in the pediatric clinic, but we are aware that this is a special population that needs special attention, and it could be also part of their social support system to be able to just make them feel like they belong and they have someone to journey. So we welcome you all next week and see you there so that we discuss more about sickle cell.
Wow. Thank you to St. Mary's Mission Hospital for taking this charge of the conversation and creating awareness. We love you, and we wish you the very best as you continue to take care of the young people, of the mothers, of the children who have this sickle cell disease, and looking forward to that, camp next week. All the very best, and thank you to all of those who have tuned into the conversation. Joseph Masindano, tuned up from Karagita, Naivasha, Nakuru Diocese. And allow me to read one comment here. This is Kevin Cheriot, who says, today is a World Hypertension Day, so remember to go and do a research about hypertension. Maybe if we had time, we could have talked about, but because our time is up, thank you very much for staying tuned to our Health Corner show, where you get an informative session and episode concerning your health. May God bless you all. Stay healthy. Keep exercising so that we can all have a good lifestyle. Please take a note on that because we see most of the lifestyle and the diseases are concerned because of the lifestyle, that is sedentary lifestyle. Exercise a lot, take water, and please keep healthy and stay safe. My name is Maureen Kimani. See you next time.
Enjoy this conversation with me, Maureen Kimani, every Friday from 9 a.m. on our Health Corner show here at Capuchin TV. Your health is your wealth. and well. Seeking expert medical care that prioritizes both your health and well-being? Welcome to St. Mary's Mission Hospital, Langata, where compassionate care meets cutting-edge medicine. At St. Mary's, we believe in providing holistic health care. Our dedicated team of healthcare professionals is committed to delivering personalized care to each and every patient. Nestled in the heart of Langata, our hospital offers a peaceful and healing environment for patients to recover and thrive.
We have masses every day, weekdays at 6:30 a.m. in the morning and also in the evening at 6:30 p.m.
Your health is our top priority. Experience the difference with compassionate care you can trust. Whether you're in need of routine medical care, specialized treatment, or emergency services, St. Mary's Mission Hospital, Langata is here for you. We offer a comprehensive range of services including outpatient, inpatient services, laboratory services, comprehensive care clinic, MCH and maternity.
We have labor and delivery. We also have postnatal care, and also we deal with mothers who've come that are sick and are there in the antenatal periods. That is antenatal care. Generally, we admit every mother who walks in labor and any mother who comes from the clinic for monitoring of labor and also delivery services. And also in maternity, we have a theatre whereby all mothers who are not delivering normal are usually taken to theatre for cesarean section.
Ophthalmology, pharmacy services, radiology and sonography, dental services, pediatrics, physiotherapy, ICU and HDU services, dialysis.
Here we do dialysis for kidney failed patients, and we do it from Monday through Saturday. We welcome you all. We accept all insurances and cash.
Specialist clinics and CT scan services. Experience your health difference with us. Visit us at Langata or our branches in Nairobi at Cardinal OTUNGA PLAZA and in Rift Valley, Elementaita, Nakuru County. For more information, contact us at 0797 972 794 or 0769 781 880 or 0717 305 204 or email us at info@stmarysmissionhospital.co.ke. St. Mary's Mission Hospital, Langata. Compassionate in healthcare. On Saturday, the 25th of May 2024, the Catholic Archdiocese of Nairobi Office of the Education Secretary will organize a one-day mega annual walk in support of Catholic education. The mega walk, organized under the theme Catholic Education for New Evangelization for Active Participation in Christian Life, will kick off from various locations following different routes in the Archdiocese of Nairobi, starting 7:30 a.m. Route A will kick off at the Queen of Apostles Seminary, while Route B will start from Aquinas High School. Those who fall under Route C will set in motion at St. Mary's School Msongari in Westlands. The walk will also commence at Githunguri, Kiambu, Gatundu and Limuru routes. The highest contributors in the walk will be awarded according to their levels of performance. First category will ride away with a brand new bicycle. The first runners-up will be awarded 5,000 Kenyan shillings and above, a polo t-shirt, a cup, a certificate, a handkerchief and a pen. Second runners-up will bank between 4,000 and 4,999 Kenyan shillings, a t-shirt, a cup, a handkerchief and a pen, while the third runners-up under the first category will pocket between 3,000 and 3,999 Kenyan shillings, a t-shirt, a handkerchief and a pen. 10,000 shillings and above, a special gift for the winners under the second category. 2,000 to 2,999 Kenyan shillings to the first runners-up, a cup, handkerchief and a pen. 1,000 to 1,999 Kenyan shillings to the second runners-up under the second category, including a cup and a pen. Between 600 and 699 Kenyan shillings, a pen and a handkerchief will be awarded to the third runners-up in the walk under the second category. The fourth runners-up in the walk will pocket between 500 to 599 Kenyan shillings and a pen. If you wish to support the Catholic education in realizing this mega walk, channel your contribution via Mpesa Paybill number 899790, account number 100-202-2000094. Keep watching Capuchin TV, your Catholic identity. This Saturday, May 18th of this year, Capuchin TV will join the parishioners of St. Joseph the Wakako Kadule Parish, along with the family and friends of Father Lawrence Munyao, for his first home Thanksgiving Mass at Chevaluki. The Holy Mass will begin at 10 a.m. This joyous occasion will be brought to you live on Capuchin TV and across its various social media platforms. Capuchin TV extends its heartfelt congratulations to Father Lawrence Munyao as he takes the mantle of his mission in the priesthood. Keep watching Capuchin TV, your Catholic identity channel.
Melchizedek.